Hi, I'm Dr. Pachowiak, and I'm an interventional radiologist with IR Centers. Today I want to talk to you about a procedure that we can offer to treat hemorrhoids. Hemorrhoids are a very common and aggravating condition that affect men and women of all ages. Hemorrhoids result when there is increased blood flow to the hemorrhoidal tissue, which is normal tissue that everybody has. But when patients have hemorrhoids, this becomes pathologic, and the hemorrhoid tissue becomes engorged with blood and causes the problems that it does. So there are a few different options to treat hemorrhoids, starting with the most conservative, which is dietary and lifestyle changes. There's banding to physically remove the hemorrhoids with rubber bands. And there is surgery. Hemorrhoid surgery is one of the most painful surgeries that exist, and it's something that most people would like to avoid. And so we offer a procedure that is very useful for patients who have had banding in the past and their hemorrhoids are recurring and they're still suffering from their symptoms. We do a procedure that's called Hemorrhoid ArteryEmbolization. So what is hemorrhoid artery embolization? It's a minimally invasive procedure where we puncture the arterial system either through the femoral artery or the radial artery. And through there, we track a catheter down into the blood supply that is causing the increased blood flow to the hemorrhoidal tissue. Once we get into the blood supply that is causing the increased blood flow, we will inject some small particles and metallic coils to cut off the blood flow to the hemorrhoid. The hemorrhoidal tissue has a very, very rich vascular system, and sometimes there are multiple arteries that supply the hemorrhoidal tissue. So we often have to go in multiple different arteries to treat the hemorrhoid. The procedure takes about 45 minutes to an hour, and the patient is in recovery for 2 hours afterwards, and then you get to go home and go back to your regular activities. Most people will find after having this procedure that by about 2 weeks, they'll start to notice improvement in their hemorrhoidal symptoms.